A hypertensive crisis occurs when blood pressure rises suddenly and severely to 180 over 120 millimeters of mercury or greater. While this is always a serious situation, it's crucial to understand the two different types of hypertensive crises, as their management protocols are quite different. Today, we're breaking down hypertensive emergencies and hypertensive urgencies, focusing on how to recognize them and what immediate actions to take, particularly in a dental setting. This knowledge is vital for healthcare professionals and can be life-saving for patients. Let's start with the more critical of the two, the hypertensive emergency. This is defined as a sudden, severe elevation in blood pressure to 180 over 120 or higher. But with a critical addition, it is accompanied by acute, ongoing damage to vital organs. This isn't just a high number on a monitor. It's a direct threat to the body's essential systems. When you encounter this situation, whether in a dental office or elsewhere, it is a true medical emergency. The first and most important step is to call 911 immediately. Every second counts, and professional emergency medical services are needed to prevent further damage and stabilize the patient. The target organ damage is what separates an emergency from an urgency. So, what exactly does this damage look like? The signs can be diverse and affect different parts of the body. For instance, the brain can be affected, leading to conditions like hypertensive encephalopathy, which is swelling of the brain, or even an intracerebral hemorrhage, which is bleeding within the brain. For pregnant patients, a severe form of preeclampsia called eclampsia can occur. The heart is also at high risk, potentially leading to an acute myocardial infarction, otherwise known as a heart attack. You might also see acute left ventricular failure with pulmonary edema, where fluid backs up into the lungs, or unstable angina pectoris, a severe form of chest pain indicating poor blood flow to the heart. These are all extremely serious, life-threatening conditions that require immediate hospital intervention. Given these potential organ complications, the clinical symptoms a patient might display are varied and severe. A patient experiencing a hypertensive emergency might complain of intense chest pain or back pain. They could experience shortness of breath as their heart and lungs struggle. Neurological symptoms are also common, such as sudden numbness or weakness. Particularly on one side of the body, changes in vision like blurring or loss of sight, or difficulty speaking, which could signal a stroke. Recognizing these symptoms in conjunction with a very high blood pressure reading is the key to identifying a hypertensive emergency. Now, let's discuss management in a dental setting. If a patient's blood pressure reads 180 over 120 or higher, and they are showing any of the signs of organ damage we just discussed, your protocol must be swift and decisive. First, call 911. While waiting for emergency services, discontinue all routine dental treatment immediately. Your priority shifts from dental care to life support.
Administer oxygen to help protect the heart and brain.
You should only perform emergency dental procedures if absolutely necessary to alleviate a source of acute pain or infection that might be contributing to the crisis.
Throughout this process, continue to monitor the patient as vital signs such as their blood and heart rate
and oxygen saturation until the emergency medical team arrives and takes over. Now, let's shift our focus to the second type of crisis, hypertensive urgency. Hypertensive urgency is also defined as a sudden elevation in blood pressure to 180 over 120 or greater. However, the crucial difference here is that there are no signs or symptoms of acute target organ damage. The blood pressure is dangerously high, but the body's vital organs are not yet showing signs of acute failure. This is still a very serious situation that requires prompt medical attention. But it's not the same immediate life-or-death scenario as a hypertensive emergency. What does a patient in hypertensive urgency look like? Sometimes they may be completely asymptomatic, feeling perfectly fine despite the dangerously high numbers on the cuff. This is why routine blood pressure checks are so important. In other cases, they might experience symptoms, but these symptoms are generally less severe than those seen in an emergency. Common complaints include a headache, often described as a pulsating pressure, shortness of breath or dyspnea, epistaxis or a nosebleed, or a feeling of severe anxiety and agitation.
While these symptoms are concerning, they do not indicate the seen in an acute organ emergency. Damage. The management for hypertensive dental office is different. While you still need to act the protocol, a 911 call.
First, discontinue any routine or elective dental treatment. The stress of a procedure could elevate the blood pressure further. You can administer oxygen if the patient feels anxious or short of breath. Just like with an emergency, you should only address acute dental emergencies, like managing pain or infection.
For immediate medical evaluation,
you should contact the patient as primary care physician right away and arrange for the patient to be seen that day. If you cannot reach their physician or if the patient has no doctor to contact, then you should call 911 or direct them to the nearest emergency department for evaluation and management. So, let's quickly summarize the key differences. A hypertensive emergency involves a blood pressure of 180/120 or higher, with signs of acute target organ damage. The correct response is to call 911 immediately. A hypertensive urgency involves a blood pressure of 180/120 or higher without signs of organ damage. The correct response is to stop treatment and secure an immediate referral to a physician. Early recognition and correct management of hypertensive crises, whether it's an emergency or an urgency, can prevent long-term complications and truly save lives. Thank you for watching. Remember to like this video and subscribe for more essential health information. Stay safe and stay informed.